Okay, it's time. It's time to start. Hi, everyone. I would like to start by thanking the organizers of this virtual event, World Obesity and Weight Management Congress, for the opportunity to share our research with you. Let me introduce myself. My name is Marlene Escobedo Monge. I work in pediatric research at the Faculty of Medicine at the Valladolid University in Spain. If you have any question, I am happy to be answered them at the end of this presentation. What I'd like to present is our result on zinc nutritional status in children with chronic diseases and obesity. In my presentation, I'll focus on three main issues. To begin, I'll give an overview of chronic diseases in childhood. After that, a brief description of zinc in human beings, and finally, I'll outline what the study consisted of. Okay, before starting, I would like to focus on this technical situation. We need to refer all support for COVID-19 vaccination for children and adolescents living with chronic diseases around the world. Today's topic is of particular interest to those of you who share our goal of improving the quality of life of people, especially children with chronic diseases. Excuse me. Diseases can be divided into short-term and long-term conditions. By definition, a chronic disease is a long-term, non-curable disease. Excuse me. By definition, a chronic disease is a long-term, non-curable condition that with a mild evolution over time are from the beginning, by definition, chronic. For example, cystic fibrosis. Now, ask yourself, how many children and adolescents living with chronic diseases? Thanks to advanced medicine and improvement of public health services, more than 90% of children and adolescents living with chronic diseases and survive beyond the second decade. In 2017, the overall prevalence of chronic conditions in childhood and adolescence is estimated between 15 and 20%. Some of these conditions require daily and lifelong medical treatment. In this slide, you can see the cycle of life in chronic disease. What is important? It's important to consider that the number of chronic diseases in childhood must add the chronic conditions that appear in adulthood. They can appear at younger age and be more severe. For example, overweight or obese children are more likely to remain obese into adulthood and to develop non-communicable diseases such as diabetes, cardiovascular disease, or even cancer in younger age. Sorry. The impact of chronic diseases on child growth and development will depend on the type of chronic disease and other associated factors, such as time, evolution, severity, organs and system involved, nutritional status, etc. What is important to remember is that while chronic diseases are more common in adults than children, chronic disease in children and adolescents can have long-term consequences and require nutritional support based on nutritional status and disease. From the nutritional point of view, adequate nutrition and periodic evaluation are key components to prevent the development of protein, energy, malnutrition, and meet the patient's vitamins and minerals needs. As you all well know, obesity is a chronic disease of multifactorial origin, and nowadays is one of the most important public health issues. It is characterized by an increase in body mass, and it can be severe pronounced with negative medical and social effects. Good nutritional status is a factor in the control of chronic diseases. Essential factor in nutritional status in children and adolescents with chronic disease could be the status of zinc. As you all well know, zinc is recognized as essential macronutrients for all life forms and is an essential macronutrient for human development. In this slide, you can see some image of macrodermatitis enteropathica. That is severe manifestation of zinc deficiency. The absence of adequate diet causes the human body to be unable to continue proper growth and development. It's more times, and the times of illness is prolonged. During the development of the child to adulthood, zinc deficiency is seen in the duration of infection as common as diarrhea, pneumonia, and malaria in developing countries. Likewise, in developed countries, zinc deficiency also appears in populations with a deficient zinc intake and or with some type of long-standing disease, where zinc deficiency is the result of an inadequate balance between income and losses. Inadequate dietary zinc intake of absorbable zinc is one of the main causes of zinc deficiency. You know that the zinc in the human body is dependent on the zinc in soils. World Health Organization, UNICEF, International Atomic Energy Agency, and International Zinc Nutrition Consultative Group recommend the use of three indicators to evaluate zinc status at the public level. That is, if a population has more than 20% of stunted growth in children under 5 years old, more than 25% of dietary zinc deficiency, and more than 20% of hypoglycemia, this population is at high risk of zinc deficiency. Now, what can we do? There are few studies of zinc deficiency and children with chronic diseases. Therefore, the main aim of this study was to evaluate zinc status in a series of children with chronic diseases using serum zinc and dietary zinc intake. This research was carried out in the nutritional unit of the pediatric service at the Valladolid University Clinical Hospital in Spain. In general terms, this research was a cross-sectional and comparative study performed in 78 patients. This series of patients was divided into groups: obesity groups, and the nutrition group, and autotrophic groups. And in all series, we performed anthropometric assessment with body composition, bone densitometry, and basal energy expenditure. To evaluate zinc intake, we carry out a prospective dietary survey, and using atomic absorption spectrometry, we evaluate serum zinc. In this slide, you can see the normal value that we use in this research. In addition, we evaluated serum albumin, C-reactive protein, and serum zinc. In this series of 78 patients, the group of obesity was 24 patients, and 62% were women. The mean age was 11 years, and the time of illness in this group was 55 months. The mean breast circumference was 17 centimeters, and the mean diffuse skin cell score was 2. Blood analysis showed that the mean serum zinc, serum iron, free albumin, and lymphocytes were normal, and only there were 2 cases with hypoglycemia. The dietary survey showed that mean zinc intake, carbohydrates, calories, and iron intake were normal, and niacin and magnesium intake were higher, and there were 14 cases with dietary zinc deficiency. Another important result is that serum zinc concentration was associated with breast circumference, magnesium intake, and serum iron, and dietary zinc intake was significantly associated with iron intake at free albumin. This study was the first on nutritional zinc status in a series of children with chronic diseases. This study showed that although 58% of children were zinc deficient in the diet, the mean serum zinc level was normal, and only 2 cases showed hypoglycemia with low zinc intake simultaneously. This result, we need to take into account that this result is important because this study should alert us to a marginal zinc deficiency, and it may explain why there were no more overlapping cases between the 2 groups. Marginal zinc deficiency is characterized by low serum zinc and normal serum zinc and low zinc intake. We need to expect that the percent of dietary zinc deficiency and hypoglycemia were the same, but it's not. And this difference will suggest that probably in this series, more than 50% of the cases in this group could be at elevated rates of zinc deficiency. According to World Health Organization, UNICEF, International Atomic Energy Agency, and International Zinc Nutrition Consultative Group, our series is at high risk of zinc deficiency because the prevalence is more than 25%. And its result is comparable to other populations at risk of zinc deficiency. These results should make us reflect on the idea that the state of zinc deficiency can occur even in patients with obesity and not only in patients with undernutrition. Another important thing to take into account is that measurement of serum alone may not show one's zinc status. And this is the reason why we perform this study using serum zinc and dietary zinc intake. In addition, in this type of patients with chronic diseases, an intervention strategy should be carried out, such as an assessment of the quality quantity of zinc intake and its relation to other nutrients. In conclusion, in this study of children with chronic disease and obesity, the mean serum zinc level was normal with low cases of hypoglycemia. Though the mean dietary zinc intake was normal, there was 50% of these patients with dietary zinc deficiency. The remaining 50% participants with a deficient zinc intake without hypoglycemia may be at increased rate of zinc deficiency. That's all. Thank you very much for your attention.